Hi everybody, this is Dr. Banarji, shoulder specialist from Sakra World Hospital. There are different types of shoulder injuries which can happen when you play sports or when you meet with an accident. So apart from the fractures and dislocations, there are various other things can happen in a shoulder joint. It can be a rotator cuff tear where the muscle tendons in the shoulder joint which can rupture. There are the ligaments in the shoulder joint, we call it a labrum. Labrum can get injured in different locations. Either it can be a labrum in the anterior part of the shoulder joint, or it can be an inferior part of the shoulder joint, a posterior part of the shoulder joint, or a superior part of the shoulder joint. Accordingly, it can cause different types of symptoms and it can happen due to different types of injury. A superior labrum tear can happen when you fall on an outstretched hand, and it can cause pain when you are lifting, throwing and all. A posterior labrum tear can happen when you are pushing a heavy weight or when you meet an accident where sudden jerk can happen and your ball is moving suddenly backside. And these are the silent problems. They usually can cause a cyst on the backside and can compress a nerve, and they can cause weakness in the posterior rotator cuff muscles. Anterior and inferior labral tear can be associated with shoulder dislocations, and there can be the cause of recurrence in your shoulder dislocations. So there are various forms of shoulder injuries, and most of the time every injury is different. They need to be evaluated properly, and the treatment of all injuries are different. So many of them need surgery, many of them need physiotherapy, and most of them need a proper evaluation and then needs to be decided accordingly. So if you are a candidate of shoulder injury, visit your doctor, get evaluated and decide what kind of treatment you need. Thanks for your attention.